Today, I'll be presenting my leadership project titled Creative Currents in Global Health, Harnessing Arts-Based Approaches to Celebrate Diversity, Gender Equity, and Indigenous Knowledge. My name is Sara Baumann, and I have been very interested in this intersection between the arts and health from a very young age. And currently in my role as an assistant professor at the University of Pittsburgh School of Public Health, I harness the power of collaborative filmmaking, the arts, and co-design in my community-engaged research studies. So here's some photos of me in my filmmaking work around the world. My leadership project titled Creative Currents in Global Health is an exploratory research initiative focused on the role of arts-based approaches in equity in global health. As a part of the project, I interviewed global experts around the world and then created an artistic reflection to reflect on key themes in each interview. As a part of this, the artistic reflections range from poetry and collage to film and painting, and are used as a way to process key insights and experiment with alternative ways of reflecting and practicing presence. These creative practices inform my own leadership journey while deepening qualitative sense-making. To date, I've completed 6 interviews from across the globe, as you can see here, and interviewees range from a number of different backgrounds, from academic institutions to government and so on. My first interview was conducted with a professor of social pediatrics in India. And in our conversation around the role of arts to advance equity in global health, her message was really that centering stories brings about change because stories resonate, evoke emotion, and people can see and feel something. She also discussed how the arts can create safe spaces and celebrate Indigenous ways of sharing knowledge. In our conversation, there was a resonant moment where she talked about a randomized cluster-controlled trial where she aimed to bring about institutional change, but the data and report sat and collected dust. So she decided to go back to the community and collect stories and drawings from participants and brought those to policymakers in the form of an exhibition. And what she found was that those artistic outputs and stories led to change. And this led me to reflect and create a montage reflecting on the power of centering people's voices in the work that we do in global health. Here is the piece that I created. And the message here is that at the center of it all, people matter. People's stories have the tremendous power to ignite change. In my second interview with a previous Foreign Service officer with USAID, we talked about the arts and global health from a different perspective. And she talked about and reflected on her experiences in Mozambique, Pakistan, Brazil, and DC. She talked about how we have much to learn from LMICs about leveraging community and cultural resources to combat things like social isolation and loneliness. One quotation that really stuck with me as I went throughout that interview was that she said that art is the fabric of so many communities. I was in Nepal at the time of conducting that interview, so I decided to do an embodied multimedia reflection in which I wandered the streets in Old Patan, my neighborhood in Nepal, looking, listening, and exploring how the arts are integrated into communities. So I'll show you a clip of that layered piece next. The short film montage celebrates life moving at a slower pace and celebrates natural soundscapes that are textured and layered in beautiful ways, and lets shots really breathe and unfold in ways that are naturally filled with wonder. I also explored how the arts contribute to community building, how they might combat loneliness and isolation. I explored how art is a cultural resource and how arts can help people feel connected and how the arts can encourage deeper relationships. So those are just some of my initial findings, but this project will continue. And it's deeply rooted in my own history and values as a community-engaged researcher, artist, and advocate, aspects that I've had the opportunity to further reflect on and invest in throughout the WomenLift Health experience, which has been a true gift. I've come to understand that creativity and storytelling are central to my authentic leadership and sense of purpose. By engaging more intentionally with arts-based methods, I aim to model a leadership approach grounded in vulnerability, imagination, and curiosity. This work asks me to lean into complexity rather than resolve it. And throughout this journey, I have been learning how to hold space for multiple forms of knowledge and influence and create pathways where all of these can coexist, inform one another, and thrive. So ultimately, Creative Currents is both a leadership project and a leadership practice. one that embraces multiple forms of knowledge and seeks to move global health towards more inclusive and creative ways of leading and meaning making by harnessing the power of the arts. Thank you.